All righty, welcome back. Module 2 for phlebotomy on OSHA and safety precautions. So in Module 2, you are going to find your video lecture, study guide, slides for the lecture, your Quizlet flashcards, and your quiz for OSHA and safety precautions. What is OSHA? It's Occupational Safety and Health Administration. It is a federal agency that holds companies of all kinds accountable for creating safety regulations to protect U.S. workers. Basically, they're the people that are here to set laws and acts to make sure that anybody working in the U.S. is safe. Basic safety concerns and protocols for phlebotomists. So making sure that OSHA basics and exposure control plans are available and made for those facilities. OSHA regulations outline ways to secure the American health worker from different pathogens, and OSHA inspectors see to the safety of your workplace and ensure all employees are meeting their standards. So yeah, your workplace can get fined because you're not doing what you're supposed to with OSHA standards. So there are regulations resulting in fines multiplied by the number of employees that could be harmed. So an employee source violation could equal termination. Remember how I just said you not following your process and safety concerns could result in fines? Well, your employer can fire you because you are not following OSHA regulations. OSHA regulations are in place to protect you and patients against all kinds of things, including bloodborne pathogens. Another term that you'll hear is OPIM or OPIM. This is other potentially infectious material. Okay, not just blood, not just pathogens in the blood, but other potentially infectious material or OPIM. Materials other than blood through which a pathogen can be exposed. So exposure control plans are a way to minimize risks by providing proper training, removing exposure risks, and providing PPE, PPE, personal protection equipment. I don't even know where I was going with that one. Created by the employer. So your exposure control plans are created by your employer, and they are responsible for providing you with PPE needed in your workplace. So OSHA requires the exposure control plan to be created by the employer, and it must have the employer evaluation of tasks, protocols updated yearly. Any and all circumstances where an employee might be exposed to disease or injury. A plan must be outlined for each position and what training will be needed to provide for that person holding that position, including waste management and housekeeping. Basic best practices for infection control. Wow, that was a lot, right? So basically every job at your place of employment or an employer will have to come up with a protocol for every single position and training for every single position to try to minimize exposure risks. PPE or personal protective equipment. So examples of PPE are goggles, visors, caps, scrubs, gowns, lab coats, and gloves. A lab manual will specify what PPE should be worn during what procedures and disposal of PPE. I will also discuss these things with you in class, okay? PPE is super important for you to be aware of. There are things that you might do that require more PPE than others. You must make sure that your PPE fits properly, that it's clean, there's an appropriate barrier from the perceived risk, and be easily accessible to the practitioner or the person doing the job. So contaminated PPE must be disposed of or sanitized immediately. All right, so part of our protection in the workplace is waste. Okay, disposing of it properly. Regulated waste is anything that could carry pathogens or biological waste, and non-regulated waste can be any material that could in no way cause injury to you or your patient. So normal trash, regulated waste. Regulated waste is stuff that has blood-borne pathogens. It can be OPIM, other types of things that could possibly carry pathogens. So making sure that you know how to dispose of biohazard waste in the workplace, which is regulated waste, is very important to your and your patient's safety. Okay, so part of this is having biohazard containers within the proper distance of where you're working. So biohazard containers are the red hard plastic containers and or red bags in that container. So waste for biohazard containers can be liquid or semi-liquid blood-soaked items that would release blood if squeezed, so saturated, pathological and microbiological waste, cultures and specimens, isolation waste. No sharps should go into a red plastic biohazard container, okay? I'm not talking sharps container. I am talking a normal biohazard container. Can be a hard red container with a red bag in it, or any other container with a red bag. It would be clearly labeled as biohazard. So a normal trash can with a red bag that is turned over so that you can see the label on the outside of the bag to know it is biohazard, or even have a sticker on it. It can be a black can. I don't care. Red bag, clearly labeled biohazard. No sharps go in that. Okay. Anything sharp can penetrate that bag and cause other injuries. So anything not sharp can go in those red bags. For sharps containers, there's no red bags usually for this. These sharps containers are designed to be heavy duty with a lid that's sometimes a one-way lid, so you can put material in, but you can't take it out. But it's puncture resistant. You never put your hands in a sharp container, which means your fingertips should never pass the opening of a sharps container. Okay. I'm not saying sticking your whole hand in. If your fingers pass the opening, you're in it. Okay. This is a serious safety violation. What if you have needles sticking up in that opening that you don't see because they're so small? You will poke yourself, and then that's an unknown exposure. And then you have to go through all this testing, and it becomes a big hassle, and your safety is at risk. Okay. All needles should be properly covered to avoid puncturing the container, but sometimes we just drop them in. There are safety engineered devices, which I'm going to cover in another video, which you should have seen in module 1 actually for phlebotomy. But those engineered safety devices are designed to cover the needle to help avoid puncturing these containers. But sometimes we don't have that option to click them, or they don't snap properly. You just drop the needles in. Okay. So sharps containers or biohazard containers on a cart should be secured tightly so they don't fall off, and they are considered full. Biohazard and sharps containers, no matter where they're at, should be full or considered full at about 3/4 of the way to the lid. Any container that's leaking should be placed in a sealed container and disposed of properly. Overfilling a sharps container can be hazardous to you. Okay. Remember how I said something about needles sticking up straight? You can poke yourself. Okay. Never let it get over that 3/4 of the way to the lid. Change it out. The most common injury for phlebotomists are needle sticks. You want to try to avoid the possibility of getting stuck at all times. Be meticulous with each of your actions. Always maintain control of your needle and never lay it down without being capped. Do not simply recap a needle to make sure you dispose of them properly. All right, I'm going to say this again. Do not recap your needle. You pull your cap off, that needle goes into the sharps container, or the safety device that is attached to it gets done. You never put that cap back on. I personally have had people stuck in class. They weren't dirty needles, thank goodness. they were used on the fake arms or had literally just uncapped it. But the needle went through the cap. Okay, I'm not talking about the end, it's from the side. If you're recapping, that needle can puncture the side of the lid and go into your finger. Okay, do not recap needles. I had an MA go through one of my classes, did the same training, no recapping, no recapping, no recapping. She went into a workplace, her sharps container wasn't nearby. She tried to recap it. She stuck herself after she had given somebody an injection. Do not recap your needles. Do not dispose of sharps in a trash can. Okay. Make sure you use the proper sharps containers. Don't overfill your sharps containers. Never stick your hand in a sharps container. If you follow these tips, I'm going to say tips, rules, just say they're rules. Okay. There's 6 of them right here. You will avoid needle stick injuries. Proper training, adequate PPE, and sharps disposal are big ways to avoid these needle stick preventions. I have some pictures here, okay, with the actual safety devices that are built into some of the needles we are going to be using in class to prevent you from sticking yourself. Recapping a needle is not an option. There are methods to do this if you absolutely have to. I recommend you coming back to this video in the slides. So you'll have to open the slides and come to this YouTube video that's built in right here. Okay. To teach you the scoop method. But honestly, I just recommend not recapping at all because still people do the scoop method wrong even after I show it to them. It's just not worth it. Okay. All right. So just a quick review of safety protocols. Always wear your PPE, shields, goggles, masks, scrubs, gloves, closed-toed shoes. Okay. You should not be wearing shoes with holes in them. Crocs with holes are also really not supposed to be worn. There are Croc version shoes that have no holes for healthcare. Okay. If you drop something, which happens a lot because we're human, it can go in that hole and stick you. All right. So report any injury to your supervisor immediately. When you're in contact with bodily fluids, it is make sure you wear gloves. So if coming in contact with bodily fluid is a possibility, wear your gloves. Use suction bulbs when pipetting is indicated. Meticulous hand washing and hygiene. Follow proper centrifuge procedures. Do not operate one unless you are trained and the lid is closed and securely locked. Never open the lid until the machine is fully stopped and disengaged. There are some centrifuge videos further along in your class. So just know that if you're like, what the hell is a centrifuge? We got some further on in the class. Never eat or drink in the lab area. Always wash your hands before and after going on break. Dispose of or clean any clothing worn, as pathogens can be attached to them. There are a lot of people that go home and take their clothes off before even hugging their kids. You can take extra clothes with you to work and change before you leave as well. Wear closed-toed shoes, a modest amount of jewelry. Remove your lab coat before leaving the lab. Do not rub your eyes or touch your mouth. Sanitize goggles worn, as pathogens can be attached to them, and change your gloves and wash your hands or use hand sanitizer before each patient. Key terms, there are some Quizlet flashcards. Please remember, I'm redoing all of my videos for 2023. I need some feedback so I can make the next ones even better. Let me know if there's any way that I can improve on these, and I look forward to seeing you in class here soon. Have a great day.